Recording in progress.
Okay, Madam Clerk, thank you for getting us technologically ready. I'll call this meeting for Thursday, July 24th for the District Board of Health, Northern Nevada Public Health to order and ask for a roll call and determination of quorum. Here.
Thank you. Vice Chair Andriola?
Present.
Thank you. Paul Anderson?
Here.
Thank you. Michael Brown?
Here.
Thank you. Dr. Rika Danko? Is not present. Steve Driscoll?
Present.
Thank you. Dr. Tuarte?
Present.
Thank you.
Madam Clerk, thank you. We have a quorum. I'll ask now, Dr. Duarte, it is your birthday, and happy birthday to you. We won't sing to you because you don't want to hear me sing, but I would ask that you lead us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Dr. Duarte, when you come on your birthday, man, that really shows some dedication. I know on my birthday I would not be here. I would be otherwise occupied. But happy birthday to you, my friend. Thank you so much for your service. Madam Clerk, we'll move on to item 3, which is public comment.
All public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for the items labeled for possible action and should be specific to the item being considered by the board. The Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding office may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given notice prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. And I do not show anybody here for public comment.
Okay, and I'll ask, is there anyone in the public who wishes to comment at this time? Hearing none, I'll call public comment to a close and ask that we move on to item 4, which is the approval of the agenda. Dr. Kingsley, do we have any changes to the agenda?
None noted at this time.
Thank you so much. I'll look for a motion.
Move to approve.
I have a motion by Ms. Andriola, a second by Mr. Driscoll. Any additional questions or comments at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? Motion carries unanimously. Madam Clerk, are we voting on our tablets today? Okay, thank you so much. So just make sure that we can clearly hear your ayes and your nays if there are any. Thank you so much. We'll close item 4 and move on now, Dr. Kingsley, to item 5, which is recognitions both for years of service and health heroes, one of our favorite parts of our meeting.
Yes, thank you very much. We'll first begin with years of service, and that's going to be presented by our communications manager, Scott Oxerat.
Scott, welcome and good afternoon.
Thank you, Board. For the record, Scott Oxerat, Communications Manager for NNPH. Happy to provide an update on the years of service, which are in 5-year increments. Our first is Jennifer Howell, our Public Health Supervisor, who is celebrating 25 years at NNPH. Second is Anna Richardson, a Public Health Investigator 2, who's 10 years with the organization. And then Kelsey Zaski, who's Office Specialist. She is 5 years with NNPH.
Thank you so much, Scott. Appreciate that.
Anybody here?
Thank you. And
Want
if you want to go ahead and continue, I believe it was Frenchie Rubio, but there was perhaps, so I'll go ahead and let you go and continue with Health Heroes, Scott.
Scott Oxerat for the record. So our Health Heroes, we have two awardees, Joe Dibble from our CCHS division on adaptability, collaboration, compassion, and trustworthiness, and then Stephanie Chen, also in CCHS, for collaboration. Congratulations to all those people.
Thank you so much, Scott. Appreciate it.
And that closes the item. Thank you.
Thank you so much. We'll close out item 5 now and move on to item 6. Item 6 are consent items. Does anyone from the board have a desire to pull any of the items off of consent? Doesn't look like it. I'll ask for a motion on the consent items.
Move to approve.
I have a motion by Mr. Anderson, a second by Mr. Driscoll. Any additional questions or comments at this time? Hearing none, I will call for the question. All those in favor, please signify by saying aye. Aye. Any opposed? Motion carries unanimously. Okay. That moves us to item 7. Item 7 is a presentation monthly given by our partners at REMSA. Mr. Duplantis, welcome and good afternoon. Madam Clerk, would you note for the record Dr. Danko is present and accounted for?
Good afternoon, Chairman Reese, members of the board. I'm Barry Duplantis, Chief Executive and President of REMSA for the record. I understand you've been provided with a copy of REMSA Health's June 2025 report. For the month of June and for the fiscal year to date, REMSA Health has met or exceeded franchise response compliance for all priority 1 calls in the franchise zones. I do want to note, as a follow-up to a question that was raised by Mr. Driscoll in the last meeting, that we are working to prepare a detailed response, and I think we have. In fact, I know we do. At this point, we've got a meeting on the books for August the 25th to go over the data to best answer that question. So that's forthcoming. During the June of 2025, REMSA responded to almost 8,400 priority 1 calls, and we transported 5,348 patients to area hospitals. Our customer survey, which is also a part of your packet, I'm pleased to see once again our score has tallied up at 94.32, which was consistent with the prior month. I'm also delighted to say that the highest noted item that the public cited was the care of concern that the medic expressed, recognizing the seriousness of their condition. And I guess at this point, because everything in the report, is pretty straightforward, I just simply like to ask if there are any questions that I can address for anyone on the panel.
Mr. Duplantis, thank you so much for being here. I want to say thank you for something personal to my jurisdiction, and that is it is not often that you're called upon to ask or answer some questions per each individual jurisdiction's needs, but in the case of the City of Reno, we had a development agreement that it had to do with a new development out in Verdi, and one of the key concerns that the community had was about the way in which the area would be serviced by emergency medical response, either police, fire, or in this case, REMSA. And it was a critical issue for the development. It really needed to be known how people living there would be served. And your team put together the data, the response, and then ultimately provided input to the City of Reno's planning department and the city councilors to be able to make that judgment call about REMSA's ability and primary response obligation to that area. So thank you for that, because that's not just the backwards looking information, that's a forward looking lens, and that helps me to understand the capacity of REMSA. It tells me that you are prepared for the evolution of this community. So for my part, both the looking backwards but also looking forward thing, thank you for that. Let me turn it over to my colleagues here on the board and see if anyone has any questions based on this month's report. Any questions here on this side? No? Looks like we're okay. Okay, Mr. Duplantis, thank you so much.
If you don't mind, I'd like to just simply comment on the question or the statement you just made.
Oh, happy to. Yes, please.
One of the things that was structured in the formation of our EMS services back some decades ago, wish I could take credit for it, but I wasn't here 40 years ago.
Well, we take credit where we can, my friend.
We try. But some 40 years ago, there was a recognition that our population moves. And the whole system design of REMSA is designed to follow people. So as new developments are built, what's really precious about the REMSA organization is that we use predictive analytics. We look at where people are, and we try to be ahead of the curve. So our ambulances are typically positioned throughout the community based on where we anticipate the next calls are likely to come from. So as new development takes place, be it in the north, in parts of Sparks, Verdi, South Valleys, you name it. Our system is designed with flexibility so that we can address those needs quickly.
Well, thank you for that, sir. You have my gratitude. I'll come back now to the body and ask for a motion for the acceptance of this month's report.
Move to approve.
Okay, I have a motion by Ms. Andriola, a second by Mr. Driscoll. Any additional questions or comments at this time? Seeing none, I'll call for the question. All those in favor, please signify by saying aye. Aye. Any opposed? Motion carries unanimously. We'll move on now to item 8. Item 8 is a presentation on the Inter-Hospital Coordinating Council's FY25 accomplishments. Andrea Esp, thank you so much.
Yes, Andrea S. for the record, Preparedness and EMS Program Manager for NNPH. And with me, I have some of our leadership from our coalition, or our leadership from our coalition, here to answer questions that you may have and speak a little bit about it. I do have a short video to show you to really demonstrate the work that this community has done over the last year. What would you like me to do?
We have some sound issues. It comes from 2 different computers, so our TS is going to go ahead and maneuver over so we can listen to it as well. So thank you for any patience.
And technology is not my friend, so I wouldn't expect it would be anybody else's.
This is where the chairman starts telling jokes.
I don't have any. I'm so sorry. Our prior chairman was great at that. He had dad jokes out the wazoo, and probably
Northern Nevada
Dr.
Public
Kingsley
Health
would
is
offer
proud
100
to
of
present
them.
the achievements of the Inter-Hospital Coordinating Council for fiscal year 2025. From strengthened partnerships to impactful initiatives, let's take a moment to reflect on the key milestones we've reached together.
We might need to pause it because now we cannot see it. We can hear it, now we cannot see it.
All of you will be required to act it out.
Yes.
This is the creative part.
Interpretive dance. Interpretive dance. You ask my children.
We will get there. Steve, would you like anyone to go and turn on at the other computer so you don't have to walk back and forth?
Well, we have to sync this to have it play on my computer while it comes through.
Let's do this. Can we get an oral presentation of the great work that you're doing? And worst,
Go ahead and play the PowerPoint, and I can talk along.
yeah, worst case scenario, what'll happen is we'll send it out to the board afterwards. Love to watch it, but also want to get people back to their day. So let's see what we can do, and then we'll figure out where we are. We might interrupt mid-course, but let us know what's going on and how you all have been doing for FY25.
In full disclosure, I did not create the video. It is my staff and who wasn't able to be present today, so she gets full credit for
Awesome.
this.
What's her name?
Oh, Andrea, what was
What's
your
her
staff's
name?
name?
Oh, Jordan Markey.
Great.
Yes.
Love that.
One of
Thank you
our
so
public health
much.
emergency response coordinators.
Okay.
Yeah, there is subtitles. Someone can read along. Yes. So just hit play from the very beginning, and I'll go through. Or I can just start from where it's at.
The IHCC has a rich history of collaboration and coordination among healthcare facilities and community stakeholders to address hazards impacting Northern Nevada's healthcare system. Formed after the 1985 Galaxy crash and formalized in 1994, the IHCC now includes over 122 partners, which composes EMS, fire, public health, hospitals, long-term care facilities, emergency management, schools, and more. The IHCC collaborates with a diverse range of partners to enhance healthcare.
Now.
I'm fine with narrating. So IHCC, the Inter-Hospital Coordinating Council, as you heard, was developed a few decades ago. It has a
Preparedness
variety of
and
different
response.
partners.
By working with EMS, emergency managers, healthcare facilities, and health departments, IHCC fosters a resilient regional healthcare system ready for emergencies. In fiscal year 2025, the IHCC strengthened regional preparedness through planned exercises, real-world emergency response, and national conference presentations. Additional accomplishments included completing hospital program preparedness capability assessments, conducting a regional hazard vulnerability analysis, and making targeted supply and equipment purchases to support community partners. The cross-border ChemPack exercise with our friends in Nevada County prepared us for sending ChemPack assets across state lines in the event of a chemical emergency. Local media filmed atop the Robb Drive Bridge over Interstate 80 as a long line of law enforcement vehicles escorted the transport. Additionally, in April 2025, agencies met for an earthquake workshop to refine large-scale disaster planning and improve regional coordination. That workshop led perfectly into the regional earthquake exercise, which aimed to bolster readiness for a major seismic event which has been identified as a primary threat in our area. Just about every local response agency took part in this exercise. IHCC had the honor of presenting twice at the National Healthcare Coalition Preparedness Conference in December 2024 in Orlando, Florida. Our presentations focused on building resilient healthcare coalitions and the vital role of interstate collaboration in hospital evacuation. Our coalition played a significant role in responding to real-world incidents such as the Gold Ranch Fire, Davis Fire, Callahan Fire, and the IV fluid shortage. We supported healthcare facility evacuations, coordinated resources for impacted facilities, maintained situational awareness, and provided community support. The Hospital Preparedness Program capability assessments aim to gain a better understanding of strengths and areas of improvement by provider type in Washoe County. These assessments have the potential to be used as a national model for assessing HPP capabilities. We identified the top 10 risks facing healthcare facilities to better target preparedness and planning. This analysis helps us prioritize our preparedness efforts and ensure we are ready to face the most significant threats. Looking ahead to fiscal year 26, we have identified key preparedness gaps and activities. The IHCC will focus on enhancing collaboration and preparedness through various initiatives, including updates and training for the Mutual Aid Evacuation Agreement, standardized training and response plans, and interagency training for surge management and transportation resources. They have also emphasized mental and behavioral health support, workforce recruitment, and advocacy for community integration. We spent $363,277 on supplies and equipment for the coalition in fiscal year 25, purchasing over 100 items to improve response efforts and community resilience. Items include mechanical CPR devices, an AMBU bus, personal protective equipment, powered air purifier respirators, isolation stations, and much more. Thank you to our coalition members and community partners. We are proud of the IHCC's fiscal year 25 progress and excited to continue advancing healthcare preparedness next year.
Ms. Esp, thank you so much. What a great presentation and video. Thank your team for the production value. Is great. Sorry we were having some technical difficulties, but we got there. Let's see if there are any questions from the body. Anyone have questions today? Okay, thank you so much. Appreciate
Can I
that.
invite our leadership to say a few words?
Love to, yes, please, welcome.
Hi, Zebna Mara, for the record. Chair of IHCC this year. 6 months left in my term, approximately. Great group to work with, a great mixture of healthcare entities that are involved in our IHCC meetings. I invite you guys to come to the meetings. It's great collaboration, great discussions that go on, a lot of support from Andrea and her staff. Probably we're like the idea people, and then they're the workers. Like, they do all the background stuff, they get us all the equipment that we need. They do an amazing job, especially with communication and helping us understand where we're at as far as like where our grant money is at and how things are distributed. So again, I applaud them because of how much work they have to do behind the scenes. Like, we throw out ideas and they're like, well, maybe we can do this, maybe we can do that. But essentially they do a fantastic job. And our leadership always has great ideas as far as moving forward with our healthcare region. But that's all I have.
And tell me your agency, sir. I apologize, I can't see it far enough to see your badge.
Truckee Meadows Fire.
Fabulous, thank you.
My boss is over there.
Here.
That's the best place to work for, and then the second best place.
Yeah, you are us, we are you. I love that. Thank you so much.
Hello, Board. My name is Leslie Alfrey. I work with Washoe County School District Student Health Services, and I'm the Vice Chair for IHCC. And on behalf of IHCC, I want to thank this board and the employees of Northern Nevada Public Health Preparedness for all of their support. Our community is truly better prepared for a response going forward.
I don't have a whole lot to add. My name is Julie Fry. I am the board member at large. I just got voted in like 2 weeks ago, but I've participated on the coalition for a few years now. And it's just really nice to have so many members of the same community who are sharing the same challenges come together and help solve those together. And definitely they do a lot of the legwork for us and bring us together. So thank you.
And Ms. Fry, where are you?
I'm at St. Mary's Regional Medical.
St. Mary's. Thank you so much.
Yeah,
Appreciate
thank
you. Thank you so much to your team again, and thank you all for being here. Great work.
Can I make a quick comment?
Dr. Kingsley.
Just want to say with IHCC, we want to thank you again. It has in the past been recognized as a national model. I can tell you that so many local entities look at you as an example and a leader, and the amount of cooperation and correlation that you do just for our region is to be recognized nationally. And so thank you for those 20 years and really what you've brought to this region and for all those that we serve. Thank you very much.
Okay, we'll close out item 8 as it requires no voting action at this time and move on now to item 9. Ms. Esp, can you lead us through this? I don't think we require a considerable presentation, but just let us know what the request is.
Of course. For the record, Andrea S., Preparedness and EMS Program Manager for NNPH. The item before you is the discussion of possible appointment of Dr. Vaughn Foster as the Emergency Room Physician Representative for our Regional Emergency Medical Services Advisory Board, otherwise known as MSAB. In the bylaws, it requires to have a ER physician to be represented on that board. Our bylaws recently changed that ER physician used to be a representative of the Pre-Hospital Medical Advisory Committee, which is really no longer in existence. So we've revised those bylaws so we can continue on having that representation. We posted the position, and we are recommending, the program's recommending that Dr. Vaughn Foster be appointed to that position. And then he would like to say a few words about himself and why he would like to serve.
Good afternoon, Dr. Vaughn Forster for the record. Thanks for having me. Currently, my roles are emergency physician with Northern Nevada Health System. I'm also their director of EMS and currently medical director for Reno Fire. I'll just give you a brief synopsis of my background. Worked at EMS and worked in EMS essentially at every level from non-emergency wheelchair transport, BLS transport, up through pre-hospital physician and critical care flight. Culminating in now being double boarded in emergency medicine and EMS. The reason I would like to join the EMS advisory board is I think it's really important to be an advocate at the patient level and community level. And I believe that I offer perspectives both from line personnel in all of those various roles. And I have served in medical direction roles from rural agencies, suburban agencies, urban agencies, so I kind of offer the whole breadth of perspectives at an advisory level as well. and just want to be an advocate from that whole breadth of experience so that we can be forward-thinking with our EMS oversight and system design and protocols. Thank you.
Well, Dr. Von Forster, very impressive. Thank you for being here. It's not always that people who are applying for various boards come to address us. So thank you for that. It gives us the opportunity to see you and put a face to a name. So thank you for that.
Absolutely.
Any questions for Dr. Von Forster? Okay, I'll look for a motion then, please.
I'll move to approve with the recommendation of Dr. Von Forester.
Okay, I have a motion by Ms. Andriola and a second, a hearty one from Dr. Duarte. Any additional questions or comments at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye. Aye. Any opposed? Motion carries unanimously. Congratulations, and thank you for your service.
Appreciate it. Honored. Thank you.
Okay, we'll move on now to item 10. We'll give Ms. Gutman-Dodson a moment to come down from the far reaches of the room, but this is an update on the just closed out 83rd Nevada State Legislative Session. And so thank you, Ms. Gutman-Dodson, for being here, and let's welcome you to the chambers.
Hello, everybody. How are you doing?
Awesome, thank you. How are you?
Doing all right.
Good.
So, feels like it was just yesterday, but also a dream away. But just wrapping up the 83rd Nevada State Legislative Session, and I have the report here for you if you'd like. I don't know if you've looked at it or not. I was going to highlight a couple things, but it's up to you. It's up to at the board's pleasure, however you'd like to go through this. I did want to just summarize a few things that our main priorities this session were to maintain our sustainable funding and avoid unfunded mandates, and we did accomplish those things. So, you know, depending on what a session looks like, wins can be defense and wins can be maintaining, you know, what our authorities and our preservation of food safety, those can be wins. So I would say we had a very successful session. We maintained our sustainable funding. We avoided several unfunded mandates. We had several wins in different divisions, including AB 360, which was prevention efforts around congenital syphilis, as well as a big win for our injury prevention chronic disease team, which was a bill that it's a little hard to explain, and I will explain in a minute, but it helps improve our suicide prevention efforts. And so that's a big win for a couple of our teams. And I wanted to take a minute just to thank everybody at NNPH who helps me. You know, I am in Carson, but there are a lot of people I rely on throughout session, and oftentimes my asks are like urgent and maybe demanding of like, I need this now. Regardless of what you're doing, I know you all have your day jobs, but I need to, we have to deal with this issue now. So this is not a full list, but I really wanted to thank Jackie because she really helped me organize the bills and disseminate which bill goes where. She really helped me with that. And fiscal notes, Jen Howell with the congenital syphilis bill, Dave Kelly on several bills, including SB 43. That was a lot of work even prior to session. Joe Dibble on the suicide prevention bill. Brendan Schneider with all of our air quality. He really kept up and helped me with those bills. Rob Fida, we had a lot of environmental health bills. Christina Shepard, Amber English, and that's not conclusive, but those are the people I probably leaned on most. So I just wanted to thank them. And then another thing I think is important to recognize is the partnerships that it takes down there. You can't do it alone, and I think we get a lot accomplished being partners with SNHD. We work well together, as well as Amy Hines Sutherland at NACO. She's done some incredible work. Had a lot of help from City of Reno, the county, NPHA, and I will never fail to forget Megan Kamlasi at UNR School of Public Health. So I just wanted to thank those people. It's not a one-man job, it's definitely a team effort, and I think we did pretty well. So just for an overview, I thought this was interesting, and I shared it with several of our leadership members earlier in the month, that there were 1,200 bills introduced, 1,210, 243 signed into law, and 87 vetoed bills in 120 days. And out of those bills, I just highlighted 40 in here, and we were involved in all 40 of those. So just out of 243, we're involved in more than 40, but these are the ones that took up, a substantial amount of time. So I just think that's very telling of how far and wide public health spreads. We are in every committee. We are in several departments at the state, DPBH, the Nevada Health Authority, environmental, NDEP, as well as ag. We face local government issues. We face state issues. So public health is far and wide, and it takes a lot of education to legislators to explain that. We're not just clinical services, we do food safety. We're not just food safety, we do air quality. We really are very expansive in what we cover. So I'm just going to highlight a few, and if any of you have any questions, please let me know. But I did want to highlight some of the major work that was done by NNPH, and one was AB 360, and that was revising provisions relating to testing for sexually transmitted diseases. This is a congenital syphilis bill, and this bill requires medical facilities, namely ERs, to offer a rapid test for congenital syphilis for people that present who are pregnant. So they are allowed to deny, they can turn down the test if they've already been tested with their OBGYN, but this is trying to capture a population of people who don't have prenatal care, who are only using ERs. So we want to provide them with a rapid test that we will have the results. The hospital will have the results by the end of their visit, and if they are testing positive for syphilis, they can get into our care so we can avoid congenital syphilis. It's a growing problem in Nevada, nationwide. We are very high up on the list of number of cases, so we're hoping that this will help mitigate that. And then the next bill that I wanted to discuss was AB 451. And this is the bill that Joe Dibble and his team, as well as a group called the Washoe Suicide Alliance Prevention Group, the WASAP, they worked very hard on this bill along with gun store owners, FFLs. So this bill provides civil liability protections to licensed firearm dealers, so that they are allowed to temporarily store and return firearms, all on a voluntary basis. So if someone comes in and would like to hand over their gun, there's no questions asked. Maybe they're in a crisis, maybe their grandkids are coming for the weekend and they don't want a firearm in their house, and an FFL can store their gun and return their gun without facing any sort of civil liability. And this has been done in several states, Louisiana and Arkansas namely. Also, Montana and Wyoming have versions of this, not quite the same. But this is mirrored language to Louisiana. And so this was a big win. It was a very misunderstood bill, I'll say it first. And then we got bipartisan support. So Assembly Leader Sandra Howdegi and PK O'Neill co-sponsored this bill, and so we got this passed. And I just talked to Joe just now because I was trying to understand the name of the alliance, and they are now going to be members of this national group called the Armory Project. It is namely focused on veteran suicide prevention, but this can expand to everyone. But this Armory Project there's studies that show even a matter of seconds of separation between your firearm and you, if you're in a crisis, can prevent a suicide. So this was a big step for Washoe County and Joe, and there were a lot of questions during the hearings of why isn't this in Las Vegas? And so now hopefully this can expand throughout the state. So that was a really awesome win. It was cool to see Joe go through the process because he was very frustrated with what was going on. I'm like, just trust me. There was like gut and replaces of his bill, and then it was in jeopardy, then it wasn't going to be heard, then it was heard, and all these last minute things, and he trusted me, and we ended up getting it through, so that was awesome. Another bill that does impact us is AB 352, and this had a lot of versions, but what ended up happening was it's been delayed, and we asked for the extension, so this isn't effective till July 2027. But cottage foods is a certain licensure of foods where people are permitted to make a very limited type of food in their home kitchens with a certain amount of dollars they're allowed to earn throughout the year. That program will now be moving back to the state, and the intention there is because it's very difficult for people, let's say they live in Churchill County, but they want to sell at our farmers markets, but they also want to sell in City of Fallon's farmers markets. They have to get separate cottage food licenses at each health district. So the intent of the state was to make it easier for the cottage food permit holder to carry out business throughout the state. So as much as we were kind of reluctant to let that go, we do understand it's easier for the consumer. It may be harder for us now at farmers markets because we're going to have to figure out if they're permitted, because they're not permitted with us. So we do have a good relationship with Administrator Goycochea, and we have kind of an agreement that we will work together in this interim. We have 2 years to figure out how this best will serve Nevada. So that happened. AB 102, as I'm sure many of you are very familiar with in this room, revises provisions related to emergency management and medical services. So this bill authorizes health districts and counties with populations between 100 and 700, which is Washoe, to regulate emergency medical services. So permitting and licensing ambulances and EMTs. It is permissive measure, meaning it will remain at the state until we elect to assume it, until we're ready to assume it. So that's AB 102. The only caveat between us and the SNHD also does the same for Clark is we are not designating trauma designations for hospitals. That will remain at the state. So that's the difference between Washoe and Clark on that bill. Trying to think what else may. There were a few bills I've noted in here that died or were vetoed. I'd say the one that was most important to us that was vetoed was that we are pleased it was vetoed. Was revises provisions related to food establishments. So this was an expansion of the sidewalk vendor bill, and we did get it to a place where it was livable, and we worked very closely with Senator Dunyate. We understood his needs, and we tried to get it to a place where we were okay with it. However, it was vetoed, and we are okay with that. So those are the ones I wanted to highlight for you. If you have more questions of these bills specifically or other bills, please let me know.
Ms. Gutman-Dotson, thank you so much for the excellent report. I did have the opportunity to read both the staff report and your presentation. Very thorough. Thank you for that. Let's see if there are any questions here from the body. Ms. Andreola?
I don't have a question, but I just want to say thank you because I don't think until you're in that kind of a situation with 120 days, and even you expressing some of the reactions of your colleagues on how is this all happening, it's really something that's difficult to even describe until you're in it. And I think it really is about a collective opportunity for whether it's NACO or some of the other organizations that have similar interests in looking at coming to consensus helps also those elected officials to, appreciate whatever those provisions or amendments are. So I just want to say a big thank you, and I hope you've gotten some rest. And I also think that it's important, and I know everyone knows this, but I want to just say thank you for what you do throughout the year, because if you're just starting something during the 120 days, you're too late.
Yes.
And I'm not suggesting that there isn't an opportunity to do that. I just think with representing the, the organization that you are committed to do that with, that it really is throughout the year. And so even with off year, because they only meet every 2 years, the work that's necessary in even preparing and creating those relationships and working collectively is a lot of work. So thank you.
Yeah, thank you for mentioning that. And it's funny, I was just talking to another local government affairs person, and the interim is becomes more and more important as you get, as money dries up, as we get newer and newer legislators. But I wouldn't say more important. It's equally as important, and there has to be a lot of prep and a lot of forward thinking. And yes, the work doesn't stop. The session did. So now we're implementing what happened and already planning for what we could do next session. So yeah, it's just a different gate, I guess.
Thank you so much,
Thank
Mr.
you.
Driscoll.
Thank you for the report and the work that you did. Having been in your shoes in my previous life for quite a while, you're really underplaying the amount of effort and the amount of time that you spent, and you're working with the advisory committee, even at the times when the session's most hectic for you personally and the people you work with. Your presentations were precise, concise, you were well organized, and you were able to hit the most important parts and give us a feel for who was working with you and for what. The relationships that you've built and the work that they've done to help this department, this part of the business of the county, I really have to say thank you so much, because that is a year-round, 24/7 job working on those relationships, and it's not just with the legislators. It's what you called as the team. So I recognize, I think everyone up on this dais recognizes the amount of effort, and thank you very much. I applaud you.
Thank you. Thank you. You're making me blush.
Ms. Goodman-Dotson, thank you so much. First of all, you said something interesting in the initial stage of the presentation, because you're always very gracious and you give a lot of credit to others. But you said it was not a one-man job.
Oh.
And I agree. It was not a one-man job. It is a one-woman job. Right? So thank you for who you
Or
are.
one member.
I understand. The truth is that we task you with a very difficult thing to do, which is to pitch yourself out on this island for 120 days every other year, and you don't get a lot of support here. You certainly did not get a lot of support from me as the chair. I knew always what was going on. You were very good at communicating that, but the pace of it means that so much has to be and reliant upon our belief in you and the work that you're doing. And so please take no sign of disrespect that we weren't communicating more often. As it was, I was very fortunate because I have a number of different hats throughout the regions where we serve, and all of the folks in my universe told me what incredible work you were doing. And you were very gracious and gave some shout out to the city of Reno. Mr. Ciccone was down there with you in the trenches. And so, of course, whenever I needed an update on anything, whether it was TUMWA, RTC, Health District, the city stuff, I was able to get it, and I didn't have to bother you in that regard. Communication is not always a strong suit from this direction going down, but it was always a strong suit coming from Carson back up. So I appreciate that. There was a lot going on this session, and I do think that your characterization of it about sometimes being on defense and really trying to hold what we had was a good way to look at it. It was a complicated session for so many variety of reasons. Some of those are political, and it's not very interesting to me because all that stuff is nonsense, but others of it was really purely budgetary, right? And it's just about what dollars we had and where those dollars could be spent. That's challenging for everybody, from the federal level to the state level down here to our level. But you held the line. And I think that's important, and I think it will be that we secured the funding that we needed to have a sustainable source, which then begets the future opportunities to keep that going and to grow it as we are able. So while there are probably moments of disjointed despair, I know your attitude was very much one of keep going, fighting the good fight, even when the days were long. And so, again, my apologies for the lack of support on my part down your direction, but know that it was because I felt that you were qualified to do the work and was very appreciative of the leadership that you exhibited on behalf of this organization. So thank you for that. Let's see, I think probably the next time we see you might be about you telling us what our priorities will be for like 18, 19, 20 months from now. I mean, you'll have a plan for where we go from here.
I think there's an expectation that there will be a special session that deals with some budgetary
October,
limitations
Mm-hmm.
this fall.
Yeah.
So I might be back.
I think that expectation is right. At least
Yeah.
the folks that I've spoken to are all but assuring us that that is the case. Obviously, some of those cuts could affect public health, quite frankly, right? As the budget is what it is, it's like a small blanket you're trying to stretch every which way. So please let us know how we can be of assistance, and we'll be paying attention to all of that as we move forward here into the fall.
Okay, thank you.
Any other questions at this time, Dr. Kingsley? Nope. Okay, thank you so much. It is identified and stylized for approval and possible action, so I'll ask for a motion for the acceptance and approval of the report.
I'll move to adopt.
So we've got a motion by Ms. Andriola, a second by Mr. Driscoll. Any other questions or comments at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye. Aye. Any opposed? Motion carries unanimously. Thank you, Ms. Gutman-Dotson.
She looks so much more rested.
Indeed. Okay, item number 11, Ms. Lavoie, you're coming down for a presentation and approval for revisions to the FY 24-26 strategic plan. Welcome and good afternoon.
Alrighty, good afternoon, members of the board. Brianna Lavoie, Director of Programs and Projects for the Office of the District Health Officer. Today I'm presenting a proposal to revise our strategic plan for fiscal year 26. This is in alignment with our ongoing commitment to organizational excellence and our accountability as well as impact. Included in your packet are those revisions for your consideration. So as you review those, I'm going to take a quick moment to talk a little bit about our process as we do revise our strategic plan. Over the past several years, the organization has established a very strong practice of reviewing and revising the strategic plan following the board retreat. So as you know, during the retreats, our strategic priorities are formally approved by you, and this provides a solid foundation to our staff for the next fiscal year's direction. I then take this direction and I work with staff in workshops to translate high-level priorities into measurable objectives and operational strategies to ensure that our efforts remain relevant and they're aligned with our mission and our values of the organization. As we look ahead in fiscal year 26, I think it's important to recognize that conversations around funding were definitely a topic, and ensuring that our staff have the capacity to make sure that these services and these programs are delivered were definitely of concern. But our teams have done a tremendous amount of work to ensure that they're being proactive in the face of funding volatility and are certainly prepared to pivot where needed. So in the spirit of pivoting as needed, our strategic plan is not a static document. I think that all of you know that. It is actively tracked, and we do monitor our performance through ClearPoint, our performance management system. And really, the system allows us to assess our progress on key indicators, measure our impact. And I also bring quarterly reports to this body to discuss with you and to also regularly report to ensure that our strategies are producing the results that we intend and to address any gaps or challenges that are coming up so that we can address them promptly. All that to say, revising the strategic plan is not just a procedural step. It's certainly a strategic imperative that keeps our organization aligned and accountable to this board as well as to our community. And we look forward to collaborating with you in the next phase of our strategic planning. With that, I'll take any questions that you might have.
Thank you, Ms. Lavoy. Let me see if there are any questions. I didn't have any, but thank you so much. No questions? Okay, thank you so much for the presentation. Outstanding work as always. This is also stylized for possible action. Is that acceptance of? Okay, I have a motion by Mr. Driscoll, second by Mr. Anderson. Beat you to it, Mr. Brown. Any additional questions or comments at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye. Aye. Any opposed? Motion carries unanimously. Item 12, Ms. Reed. This is a you item.
Hello. All right. Dania Reed, Deputy District Attorney. For the record, this item was continued from the last meeting at the request of the chair so that we would have a more robust board present. The idea here is that once a year, the board is offered the opportunity to review the interlocal agreement that establishes the health district and to determine whether or not the board would like to see any changes to that arrangement. Historically, what has happened, and the only modification that has taken place under my tenure, is the name change from Washoe County Health District to Northern Nevada Public Health. In that instance, the board determined that they would like to pursue a name change. After that, a concurrent meeting was held between Reno, Sparks, and Washoe County with the councils and the commission to discuss the name change and whether or not they wanted to approve it and bring it to the various jurisdictions to approve. A decision was made to pursue the name change, and the revision amendment was drafted, and that amendment was brought before both city councils and the commission to approve separately. Once that was done, it became effective. The timeline here is that that process would have to be complete by October 1st, in the event that this board had any changes that they wanted to pursue. So essentially, the board can discuss, any member, anybody who has something in the interlocal agreement that maybe they would like to see revisited, they can have that discussion and direct the public health staff to bring that back before you to take a vote on, to then send to your various jurisdictions for consideration. You could reach an agreement today that something was important, and you would send it back to your various jurisdictions for consideration, and then it would be up to Reno, Sparks, and Washoe County to determine whether they wanted to pursue any recommendations, and then, of course, to vote on doing so, and then any subsequent amendment to the agreement. But that process occurs once a year, and by the terms of the agreement, it has to be done 90 days before January 1st.
Understand. Thank you so much, Ms. Reed. I actually was responsible for continuing the item. I think the ILA is in order, but I was reluctant to have our decision with Ms. Andriola's absence last time, because so much of what is included in the ILA requires really a symbiotic relationship with the county. And so I had no belief that it needed changes or revisions, but simply was uncomfortable making those calls without Ms. Andriola being here. And so I'll just turn to my colleague and inquire if there was anything here that you or your staff have uncovered that needs review. If not, we're ready for a motion on this item.
Thank you for the consideration, and I do apologize that I wasn't able to attend.
Oh, no, you were attending another conference
Yes.
related to your other duties. No problem.
Annual conference.
Yes.
And so I do appreciate the deferment, but I am not going to bring up anything that has been noted, and I'm happy to make the motion to approve.
Appreciate your motion. Thank you so much. I'll look for a second from Mr. Driscoll.
Mr. Chair?
Yes, Mr. Driscoll. Let me first say that we've got a motion and a second, and now we'll move into discussion on the motion.
Discussion, clarification from the attorney, if I could.
Yes, Ms. Reed, Mr. Driscoll has a question.
Currently, Washoe County, Sparks, and Reno are directed by legislation to look at service of emergency medical services and fire. And that could be anything from keep it where it is to full consolidation merger. Since we're a subset of the county, does that provide us with the ability to participate in that conversation or to insert ourselves into it? Or does it exclude us because we're our own entity and we're a subset of the county?
I think I understand your question, and I don't know, only because I haven't looked at that legislation. I think one thing that's important is if you are talking about ambulance service specifically, both the cities and the county have delegated that authority to provide exclusive franchising for ambulance service to this board. So I think in terms of that discussion, this board may have a role, but I don't know specifically. I think it is a valid conversation because that piece has been delegated to the District Board of Health. The District Board of Health, I don't believe, has any role in fire services outside of EMS, but that delegation has occurred. And so to the extent that ambulance service, an award of franchise and exclusivity and whatnot that has been delegated to this board for the greater Truckee Meadows area would be a subject of what's being looked at. Certainly, I think that this board may have a voice, or the health district may have a voice, because there is an existing franchise award, at least through 2030. So I think that's a relevant question.
Thank you for that opinion. With that, sir, I'm prepared to vote when you call for it.
Thank you so much, Mr. Driscoll. I think it's important that you got that answer. It is important because so much of the ILA requires us to have a cooperative and interlocal, truly in the truest sense of it, approach to it. So thank you for that comment. I'll call for the question now if I have no additional questions. Okay, all those in favor, please signify by saying aye. Aye. Any opposed? Motion carries unanimously. Thank you, Ms. Reed, for your help there. Item number 13 are staff reports and updates, which is always one of the highlights of our meeting. So we'll start with Mr. Peterson as you make your way down. Thank you so much. It was always also interesting, Mr. Peterson, to see how many air quality management bills were introduced in the legislature and how many of those affected us. So Ms. Gutman-Dotson's earlier presentation reminded me that you'd be talking to us later, but no overlap. I'm just saying it was a lot of work there going on in the air quality world.
Always a lot going on in the air quality world.
Always. It seems like it. Thank you for being here. We welcome you to make your presentation.
All right. Thank you. Good afternoon, Chair Reese and members of the board. My name is Craig Peterson. I'm the Monitoring and Planning Supervisor for the Air Quality Management Division. I'm filling in for Director Francisco Vega today, who is out on leave. You should all have your director's report included in your board packet, but I wanted to provide you an update on Section B under Program Updates, which is related to EPA's fiscal year 2026 proposed budget justification. What's written in the director's report is now a bit out of date. The latest news we received from the National Association of Clean Air Agencies on July 14th. The Association of Clean Air Agencies is sort of our liaison between state and local governments and the federal government. But what's written in the report, it was a 54% agency-wide reduction in EPA's overall budget. What is now proposed, it has decreased down to 23% cut, which is still big, but the elimination of the categorical grants such as the 103 and the 105 are not proposed to be cut much, if at all. The 103 and the 105 grants, these are the federal grants that basically allow us to do our work in air quality, especially in the monitoring and planning programs. So this is great news, but we remain cautiously optimistic on that front as things do change quickly there. Then moving on to program reports. As far as the monitoring and planning sections, we did have one exceedance of the 8-hour ozone standard. with a concentration of 74 parts per billion. That's it was a rare overnight exceedance of the 70 part per billion standard. High ozone levels typically occur in the afternoon when it's hot and when the sun is shining bright. When they occur overnight, it's likely has to do with stratospheric ozone intrusions or simply ozone transport from other areas. I contacted the National Weather Service on this, and it doesn't look like it was a stratospheric ozone intrusion, so it was likely transport from probably Sacramento or some of the foothills just above Sacramento. So one exceedance there, and then, which is not uncommon in the summertime, I should say. And then, let's see, finally, kind of moving on to the permitting and compliance section. I think the numbers pretty well speak for themselves. Our permitting team was back up to 100% timely completions of all the plans received in the month of June, so that's good news. And then you have the numbers in front of you. So if you have any questions, I can take those.
Thank you, Mr. Peterson. I have no questions because I would not hazard to guess what you just said. All of the information, of course, about the grants is well appreciated and thoughtful. I don't know what ozone exceedance is, and so I know that you're monitoring it. You would tell us if it was something we should be concerned about, but that was rather technical, so thank you.
Okay, well, that tells me maybe we need to do a presentation to the board.
Well, maybe we'll take that one offline because it sounds fascinating, and the way you speak of it shows me your passion about the topic. I just know that it was very scientific.
All right.
Appreciate that. Any questions or comments for Mr. Peterson rather than my silliness? No? Okay, Mr. Peterson,
Right.
thank you so
Thank you
much.
very much.
Appreciate that. Okay, we'll move on now to our next report, which I think is Ms. Shepard. It's moving down already. Welcome, Ms. Shepard.
Hello, Christina Shepard, Division Director of Community and Clinical Health Services. Our board report for this past June featured our client satisfaction survey results. Once again, we would continue to receive overwhelmingly positive client satisfaction results when we do our surveys every February. So commend our staff for the excellent care and education that they provide. We did see some improvements in client satisfaction with scheduling appointments. So we've been working really hard on allowing for walk-in appointments and dedicating somebody on phone calls every day to schedule appointments quickly. Another thing I'd like to point out in the report is our WIC program, our Supplemental Nutrition Program, had a biennial program review from the state WIC office, and the auditor commented that it was one of the best audits they've ever done. They really commended the WIC staff for their exceptional customer service and a clean and welcoming environment, so congratulations to the WIC staff. This will be the last month that CCHS reports on sexual health and chronic disease and injury prevention activities. So those activities will now be featured in the Population Health Division's report. So they have transitioned over to Population Health. Still working out some couple things with offsite testing to continue those services, but for the most part, a relatively smooth transition. And I'm happy to answer any questions.
Okay, let's see if anyone has any questions for Ms. Shepard. No questions? Thank you so much, Ms. Shepard. Thank you for the great presentation. Congratulations to the WIC team. Okay, we'll now move on to Mr. Fida. You're up next with EHS reports. You've been very busy.
Good afternoon, board members. I was going to say it has been a very busy season in EHS. Ms. Gutman-Dodson was able to help us alleviate some of our potential unfunded mandates that may have been coming our way. But I kind of wanted to highlight some of the work that our EHS folks have been doing. I was going to say recently we just hosted our Special Processes Fair. This is the first one. And this is a fair designed for restaurateurs who are looking to maybe kind of elevate some of their food handling and skills and make sure they do it in a safe manner. So this is smoking, curing, kind of reduced oxygen packaging, sous vide, and stuff like that. So this is an opportunity for them to ask questions, get information from staff on how they could potentially implement these processes in their restaurants if they so choose to. Our food plan review team, they've been holding office hours that are readily available to the public. So every Tuesday, 10 to 12, our staff will be doing office hours for anyone interested in potentially doing either plan review or asking questions of our food staff. And that's been successful. And then June has been very busy for our staff as well. Temp food season has been in full swing. So we had the rodeo, that was 11 days. Our staff did over 100 inspections. And then to top it off, they were able to juggle other events. So we also had Taco Fest, which overlapped. So that was another 20 inspections. So our staff have been extremely busy this season, but they've been doing a great job. Rodeo was successful, according to staff. All violations were corrected on site. And then staff have been seeing an uptick in some home-based tattooing shops. So we've been responding to complaints like trying to address some of those. And then additionally, our team for the septics teams has been working to they've been proactively working to find, new sand for sand filters. The existing pit there was an existing pit that was the sole source for sand filters currently in the valley. And so that pit is projected to close, so that source of sand is running out. So we need to find a suitable replacement. So our staff have been working with local engineers and essentially these, the laboratories and these sand pit operators to try and find a blend that would be suitable for these septic systems. So I believe they're successful. They've identified a few options, and we're continuing to explore that as we go forward. That's all I have for my updates. I'll open it up to the board if the board has any questions.
Mr. Pida, thank you so much. I want to just say thank you for the work that your team's doing. I'll be joining your group on August 4th for one of the food safety courses. I'm very much looking forward to that. I don't know if I'll want to eat out much after that, but we'll see how it goes. I'm told they'll keep me in good stead. Thank you for all the update, too, about the special events. I know there were quite a few unique scenarios that arose during the rodeo, and so thank you for your staff for answering those in a timely manner and for the corrections on site. Let's see if there are any questions from the board. Mr. Anderson.
Not a question, just a compliment. And I want to say thank you for the work you guys do, and not just your division, but all of them, because you guys get into so many different things that you would think that doesn't have anything to do with you, and yet you're able to assist. And what you mentioned about the sand for the sand water separators, I would never even think that you guys would work to assist in that. Yes, it's necessary, it's there, but I just want to say thank you for going above and beyond. That I think that's so cool to see the department. I mean, a focus on education and how can we help? What can we do to help the community? And I just want to say to all of the divisions, you guys are doing a great job. I appreciate it.
Thank you.
Okay, any other questions? Thank you so much, Mr. Fida. Appreciate you today.
Thank you.
Dr. Dow, you're next up. Population health.
Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Population Health. So July marks the official launch of the newly named Population Health Division and the integration of the Sexual Health Investigations and Outreach Program and the Chronic Disease and Injury Prevention Program into the division. And our Statistics and Informatics program is also progressing very nicely with the welcoming of our supervisor in June. So that being said, you have my report. I have nothing to change or add. A few quick highlights. So public health preparedness supported and coordinated an radiation exercise on July 22nd, so just this week, aimed to test and strengthen local emergency response capabilities during a radiological incident. Event was conducted in two phases. So beginning in the morning was a tabletop exercise at the Regional Emergency Operations Center, and the second phase was a functional exercise at the Regional Public Safety Training Center. So fire, law enforcement, EMS, public health, hospitals, and various other partners attended and provided a very realistic opportunity to evaluate preparedness on a radiological emergency and practice integrated response operations. And in epidemiology, our outbreak numbers right now has been pretty low for the recent 2 months, not surprising given that school is not in session. Both June and so far in July has been seeing majority of our outbreaks being gastrointestinal and hand-foot-mouth disease. We also published in the Epi News this month our quarterly communicable disease reporting and statistics for the second quarter of 2025. So this series covers tables and figures to compare reported morbidity of selected communicable disease during the most recent quarter and in comparison to historical morbidities reported over the past 5 years. Increases seen in this quarter of 2025 compared to previous years were in respiratory syncytial virus and in our animal bites reports. And that's all I have for my update. I'm happy to answer any questions.
Dr. Dow, thank you so much. Anecdotally, it seems like we've had some uptick of colds, summer colds, only because I see everybody on Facebook tells me they have a cold. And then one of the people in my household had COVID. So I just didn't know. I do read the reports when you send them, so it didn't seem like there was a huge upswing, but it seems like it was that time of year.
Yeah, so nationally, from CDC reports that we're seeing, there is an increase or even projected increase of COVID in 26 states. This is mostly in the southeast, southern states, or some of the western states. Nevada so far has been good, and our numbers, if you follow our respiratory dashboard, still very low. Just before this meeting, we checked our syndromic surveillance, which is our urgent care and emergency department visits, and those are still low right now for COVID.
Great news. Thank you so much for that update. Any questions from the board? Thank you, Dr. Dow.
Thank you.
Appreciate you. Dr. Kingsley, closing us out here.
Thank you. Just take a few moments. Want to just, it will be my next report, but just wanted to report a recent conference attending the National Association of City and County Health Officers or Officials. It's an annual conference, but the importance of it right now is information is currency, and so it's really connecting with other local health departments as well as advocacy in DC. An example of why we were there, we were informed that the federal government had released the notice of award for tobacco and sent that to my state contact, and about 20 other states had not received any notification either, and it was due on Monday within 3 days. And so just being able to provide that information to help us is a value to us and currently right now of how we are navigating these times. So it was wonderful to connect with other states and see their challenges, which are very similar, but of working together and how we can continue the work of public health. Other than that, just in the report to highlight, wonderful communications, again, always very interactive, both on social media as well as press releases for connecting and communicating with our community. Part of our workforce development, we did have a all-staff training that bringing those in that is funded through a grant that allows us to be able to provide these trainings to our staff and support the staff that we have and to continue to strengthen them so that they're able to empowered to do their job and increase and develop their career. And then lastly, I've just probably one comment I'll be making next while. This is part of our 3-year process, but the CHA and the CHIP, our community health assessment, which leads to our community health improvement plan, is continuing in conjunction with Renown so we can discover those things that our community wish us to address and improve within for ourselves and within our region. So at that, I'll just go and open if there's any questions.
Any questions for Dr. Kingsley?
I have a question. Has there been any additional feedback in terms of from the community with concerns when the body chose to move forward with the recommendation of looking at not having mosquito treatment being totally cut, but some of the messaging indicated? I know I had a lot of my constituents, if you will, and some folks. And I know that you all have done a great job in terms of sharing that it isn't just gone, it's literally still being able to be treated, but with budget constraints, it isn't putting anybody in jeopardy or having a safety issue. And I'm just wondering if you've seen that either kind of stabilize, or if you've seen an increase, or what that looks like. Thank you.
Great, thank you. And actually, I just spoke with some of the program coordinators the other day asking the same question, where we're at on it, monitoring those. Thankfully, through the months of June, our temperatures, when you look at our temperatures, if it doesn't go below 80 at night, or some right on 70, then we will see an uptick in mosquito populations into the thousands. And so recently, we had warmer weather. We have been doing surveillance. We've been doing collection on all those points as outlined. So they've been very busy on onboarding. So we had a little bit delay in onboarding. So usually we bring on an intern, and they go out and they set up the traps and they collect them and bring them in. But those interns are now actively in the field and collecting mosquitoes for us. As communications go, we had a really good month. We had minimal things that come in. We do address those, but complaints have been very, very low. But because of the warmer weather, we are anticipating that perhaps this month we are going to begin to see those things. And please contact us as we outline 311, and we are willing to address those. The drone is ready where we need to and such things. So, timely question with our warmer weather. So, thank you.
Mr. Chairman, I have a follow-up, please.
Of course.
I really appreciate that, and I was thinking of, I was lucky enough when I was at the conference to miss the triple-digit experience you all had, so I was like, darn, I kind of missed that. But my point is that I wonder if there, given the chair and your direction, if there might be an opportunity to just give us an update, because it is at the top of folks' minds, and I think it helps with the transparency in terms of even the decision is not necessarily, as I mentioned earlier, jeopardizing or putting folks in an issue of concern, and so I'm just asking for consideration to maybe have an update. Thank you.
And on the note noted, we will happily come. We are data people, so we will be able to come and present and where we're at in the next steps and provide those numbers and what we've been observing within our community. And we'll look for that for August. Thank you.
Okay, any other questions for Dr. Kingsley? Okay, we'll close out that item and come to you, Madam Clerk, for our final public comment period.
All public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding office may order the removal of any person whose statement or conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and duly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. And I do have public comment.
Hi, everyone. This is Molly Rose Lewis in Senator Jackie Rosen's office. I missed that first public comment, but I have been on this whole meeting. Really appreciate everyone and all the work that you're doing. I just wanted to make sure that you know that I'm here, our office is here, and we are trying to keep tabs on everything federal and all of these cuts and potential cuts. So it's interesting to hear you talk about some of the ones that are potential or how they could affect you. We would really appreciate on our end always hearing about if there are specific programs that are going to be cut or would be cut due to any federal budget changes. It helps us then be able to advocate for those programs in different ways and how we can push back on any cuts and advocate for funding for you. And I am the actual grants manager for our office, for Senator Rosen's office. And if you are applying for federal grants, please do let us know if you would like letters of support. I work together with Senator Cortez Masta's office and Congressman Amday's office as well to get our whole delegation on board to make sure we're presenting a united front as much as possible to get that federal funding here to Nevada. So please just continue to keep me posted. And if there's anything that I can do to help you or track any information down on the federal level, we are always available. Thank you so much.
Molly Rose, thank you so much for being here and for listening in. I'm going to ask Dr. Kingsley to get together with you in your office in the next 30 days and identify any areas of concern that he has or our division departments have and see what we can do to get you information that you might need. It sounded today like both Mr. Peterson and Ms. Shepard had some areas of concern, but it might be larger than that. So Dr. Kingsley, that'll be something I task you with to reach out to Ms. Lewis and have those conversations.
More than happy to do that. Thank you so much.
Thank you so much. We'll close out public comment now and bring it back to the board for board comment. This is the opportunity for any board member announcements, and we're going to start to my left to see if anyone has anything to add. I'm going to come over to my right and ask Mr. Driscoll to spend a little time with us. Mr. Driscoll, I think you traveled this last week with Dr. Kingsley and some other staff, and so I'd like to just hear a little bit about it.
Thank you, Mr. Chair. Yes, I was fortunate to be invited to tag along with the team, and being new to the board, I was looking forward to it as a national conference. They have a lot of education tracks on the various topics of the services that public health provides all across the country, and so a lot of those were very relevant to what we do here. And so it was everything from vendor presentations for new tools and toys, all the way to best practices discussions from the people that are in the field doing that. And then also some worldwide topics in the open sessions. And so I found, I've been attending these types of conferences for years, and so I always go in to every single class that I go to or session just looking for a nugget. And I was not disappointed. I had plenty all the way through, and even some of the ones that as you got into it, you realize the topic really wasn't something I needed to deal with. You stick around, you learn something anyway. So for anyone that has the opportunity to attend that in the future, it's a good way to spend a good 3.5 days. You can pack your schedule and go from early in the morning till dinner time, and just every topic as you change gets you excited about what's going on. And the one thing that I will say is that with several of the classes, even though I have minimal knowledge of exactly how we do certain things, I have enough knowledge to know that we're doing them, and I believe we're doing them well.
Well, outstanding. Thanks for that, and thanks for taking time away from your family and your busy life. We appreciate it here at the Health District. Thank you so much. Any additional questions or comments from the board at this time? Okay, I'll come back then and close this meeting. We're now adjourned.
Recording stopped.